Every 3 minutes, a baby is born with clubfoot deformity. It is one of the most common naturally occurring birth defects and is present in every country around the world. If left untreated, clubfoot can lead to a lifetime physical disability. Surgical procedures often result in long-term pain and stiffness, but a gentle, non-surgical method has revolutionized clubfoot treatment forever. These are the stories from people around the world using the Ponseti clubfoot treatment method.
So we first found out that Nate had talipes at the 20-week scan, so the anomaly scan, which was just before New Year's Eve.
The lead sonographer at the hospital found a problem and that she thought it was something called talipes, club feet. We came home and I went to bed and cried for about 3 hours, and Ian sat at the computer for about the same amount of time and researched.
I spent the sort of next few hours reading all the research studies that were out there, sort of international ones, British ones, American ones, just to find out kind of what was this thing, how does it get treated.
When we first got our diagnosis and they were talking about the fact that he'll wear boots and bars until he's 5, I just remember thinking, that's so long, he'll be at school when that happens.
It was essentially, a protocol was 6 weeks of weekly casting to reshape the feet from that to that, followed by a tenotomy.
The tenotomy procedure,
so the cutting
of the Achilles tendon, my knees just gave way and I just cried and cried and cried, and he was still only sort of 6 weeks old at this point. It was that was really hard. And
then going into the boots and bars braces for the next 3 months for a lot of time, and then relaxing down to sort of overnight for the next 4 years, which we've just finished.
You know, Nate is a incredibly active, nearly 5-year-old. He loves climbing frames, he loves running. But there's nothing physically that Nate can't do.
It's based on the understanding of the deformity, which is not developed in the embryo, but in the fetus, in the middle of pregnancy, those 16, 20 weeks of pregnancy. The foot, which is completely normal until that time, deviates, becomes deformed. But it's a normal foot already. So when the baby is born, the foot has been deformed only for 2 months, a month and a half or 2. So you have to kind of invite it to go back to where it was.
The Ponseti method is a medical technique for the treatment of a birth defect, the most common birth defect involving the newborn foot. The foot is twisted out of shape, and the Ponseti method is a technique whereby, without hurting the baby, one can gently push the foot in the direction it needs to go, and then put a cast on to hold it in that direction. And that's done over a period of time, perhaps 4, perhaps 5, perhaps 6 casts. And by the end, the foot and all the bits of the foot are normally aligned.
There's the doctor phase, which is get the clubfoot corrected with manipulation and casting. And then there's the parent phase, which is maintain that correction by using a brace that will prevent relapse as the child's foot grows. So the child's foot grows most rapidly in the first 5 years of life. And if you don't wear the brace, the number one cause of recurrent deformity is inability to wear the brace or lack of compliance by the parents with putting the brace on and getting the child to wear the boots and bars, as some people call them, which is basically a brace that has a bar that connects the feet together and rotates the feet outward.
So this is Beckett Werner. We found out he had bilateral clubfoot. It was probably what, about
18 weeks.
Ultrasound.
You know, you don't ever want any diagnosis to be bad, you know, for your baby. It was very devastating. You know, we didn't know what to do. We didn't know any doctors where we're at in Indiana who would deal with it. We were really ecstatic whenever we got Dr. Dobbs' name.
The Ponseti treatment method, what's unique about this is it's serial casting. So it's done in the office, in a clinic setting. There's no anesthesia required. So the baby is on an exam table with the parents there. The foot is very gently manipulated and stretched for about a minute. And this is followed by holding that manipulation with a plaster cast.
Started coming up here right when he was, what, like 10 days old?
Yeah, right at 10 days old, and we started casting and did casts every week until he was about 8 weeks old. It was like a blur. I don't even remember him, you know, having the club feet almost. It's been such a fast process. Say hello, Dr. Dobbs.
He's growing up on me. Tolerating things okay with the brace?
Yeah, I mean, there's nights where he doesn't seem, he likes to toss and turn, and it's tough with the bar on, but he does all right. If you didn't tell people, they wouldn't really be able to know for the most part that he even had it. So they've got good position, and he does pretty good, and he gets around everywhere.
Well, that's thanks to the routine you guys have set up. You know, that's what makes it effective, and his feet look fantastic. And next time you're here, you're probably looking at getting a bigger bar.
Okay.
We do that, you know, when they're getting closer to 1, and that'll be the bar that lasts you the rest of the time.
Say thank you very, very much
Enjoy
for
the summer.
everything.
So cute.
I have examined your baby and I find that child has got clubfoot, but no other associated anomaly has been found. So it's one of a kind clubfoot deformity in your baby. Now this deformity with current Ponseti method can be completely corrected. Once you've done that, index to thumb, thumb to index. The change of hand is very important. Huh? Index to thumb, thumb to index.
We will start the cluster and manipulation today, and we will do the serial casting and manipulation for about 5 to 6 weeks. After full correction, this baby will wear the braces for 4 to 5 years, followed by regular checkup in our Ponseti clinics.
Neglected clubfoot is more prevalent in remote regions where access to medical care is difficult. But thanks to outreach from practitioners trained in the Ponseti method, many children have been given new hope.
Very good.
আমার এই ছোটকালে আমার এই যে ছেলে যখন জন্ম হয়েছে তখন এই ছেলের পায়ে সমস্যা ছিল। ছেলেটাকে নিয়ে যাওয়ার পর মেডিকেল কলেজ হাসপাতালে ডাক্তাররা বলছিল যে ওর প্লাস্টার করা হবে। তারপরে প্রতি সপ্তাহে ওর প্লাস্টার করা হলো। প্লাস্টার করে যেই পা সোজা হয়েছে তখন তারা জুতা দিয়েছে। আর সেই জুতা আমি প্রতিদিন ছেলেকে পরাই 12 ঘন্টা।
আস্তে আস্তে উঠো। কাকা ওড়ো। না পড়ে দে। একটা হাসি দাও তো, হাসি দাও, হাসি দাও, ওইদিকে তাকিয়ে হাসি দাও।
তারপর ছেলের পা আল্লাহর নাম নিয়ে সবার দোয়ায় ছেলের পা সুস্থ হয়েছে। এখন আমারও মন খুশি, ওর আব্বুরও মন খুশি, পাড়াপড়শি সবারই মন খুশি। আর কিছু বলবো?
The Ponseti Clubfoot treatment method takes place in 2 phases, the casting phase and the bracing phase. In the casting phase, a series of plaster casts are used to gently stretch the flexible tendons and ligaments to progressively move the deformed foot into proper alignment. Ideally, this process will start within the first few weeks after birth. The foot is gently stretched for about 1 minute towards a more favorably corrected position. Holding the foot in place, a protective layer of cotton is wrapped from the tip of the toes to below the knee. Then, the same area is wrapped with plaster of Paris, forming the outer layer of the cast. The cast is well molded so that it holds the foot securely in place while the plaster dries and hardens. Casting then continues above the knee, forming a full leg cast from the tip of the toe to the top of the thigh, with the leg bent at 90 degrees, which prevents the cast from slipping off. The cast is carefully cut away from the toe area. Over the next 7 days, the cast will soften the ligaments in the foot and help retain the new degree of correction. At each weekly follow-up visit, the cast is removed, the stretching and manipulation process is repeated, and a new cast is applied. With most clubfoot patients, it will take around 4 to 5 weekly cast changes for the foot to reach the maximum correction that is possible with casting alone.
It says no, because this is the most common mistake, is to put the thumb or the fingers on top of this. If you put your thumb here, you immobilize this joint, and therefore you can never correct a clubfoot that way. The foot is corrected by putting your thumb over the lateral aspect of the talus here. Then the correction is very easy.
To me, it's one of the best feelings in pediatric orthopedics is to watch the parent's face as they see their child's foot go from deformed to corrected. It really is gratifying.
Para mí el método Ponseti va mucho más allá de la pura manipulación, enyesado, prevención de recidivas o tratamiento. El método Ponseti tiene una parte humana que el doctor Ponseti me transmitió. Hay que sentir tocando y aprender a notar con la punta de tus dedos cada prominencia del pie. Cuando tú entras en diálogo con el pie y el pie te está explicando qué necesita para ser curado. Cuando tú llegas a este diálogo, como Ponseti hacía, estás tocando con la punta de tus dedos la excelencia de la filosofía y magia Ponseti. Se pueden usar muchas escalas para valorar el pie, pero la más fácil en la práctica clínica es esta, que es la escala de Pirani, y el pie de Kai tiene un 5,5 sobre 6. Eso es bueno, porque quiere decir que tiene flexibilidad. Mira qué tranquilito está, eso es porque no le hacemos daño.
Y en la familia no había nadie, ¿verdad?
Nadie.
Pues que estoy muy agradecido a mis padres por la decisión que tomaron de ir a Barcelona a conocer a la doctora Ana y también haber tenido la suerte de conocer a Ponseti en persona cuando yo era un bebé. Y gracias a que me trataron con el método Ponseti, pues puedo hacer vida normal y jugar a fútbol sin ningún problema.
El método Ponseti es muchísimo más y se debe de seguir todo el protocolo muy estrictamente para tener estos buenos resultados que describió el mismo doctor Ponseti y que se están viendo en todas las publicaciones de los profesionales que estamos realizando este método muy estrictamente.
In a majority of clubfoot cases, a tight Achilles tendon prevents the foot from reaching full correction with casting alone, so a small, simple procedure called a tenotomy is often required. Local anesthetic is used to reduce pain during the tenotomy. After waiting a few minutes, a thin scalpel is inserted behind the ankle and is pressed firmly until the tension is suddenly released, indicating that the Achilles tendon is completely severed. If the tenotomy is successfully performed, the once restricted foot now moves freely up and down. The foot is held at maximum correction while the final cast is applied. The cast will remain on the child for 3 weeks, allowing the heel cord extra time to automatically reattach and begin to strengthen. This is a very reliable process and gives the Achilles tendon the additional length necessary so that the feet can finally reach normal alignment. At this point, only a few weeks have passed from the very first casting session to the final cast removal after the tenotomy. To parents and other family members, it may appear that the entire treatment process is complete, but this correction will need to be maintained and strengthened over time with appropriate bracing.
Afternoon, we are Ad van der Wildenberg and Arnold Besselaar from the Maxima Medical Center in Veldhoven. We are the chiefs of the treatment of the clubfoot in our hospital. Of course, we treat the clubfoot with a lot of other people.
I'm the plaster technician. I will help my colleague Arnold to fix the problem with the children.
Okay, so this is the final position of the clubfoot treatment. This is just after the tenotomy, and now the plaster is made for the upper leg. It's all very gentle, no force is used. This is the last plaster. This will be in place for 3 weeks, and then the plaster is removed and the boots and bars has to do the last part of the job. So now it's molded, and you see the position of the foot. It's beautifully corrected. And this is the position, the final position of the clubfoot treatment by Ponseti. Perfect.
الطريقة نتيجتها أكتر من هايلة، يعني الطريقة الوحيدة في جراحة العظام اللي نتيجتها بتوصل 99% دي صورة رجلين ميرا ساعة الولادة، ساعة ما جت. والناحية الثانية نفس الشيء.
أنصح كل الأمهات اللي هم اكتشفوا حالة بنتهم أو ابنهم البيبي بتاعهم بحالة الكلافوت دي إن هم يتبعوا تعليمات كويس جدا في إن هم يلبسوا بريز اللي هي بتحافظ على مستوى الرجل زي ما هو، وإن هي ما تتغيرش وما ترجعش ترد تاني زي الأول.
فالحقيقة كل الدكاترة في مصر تقريبا مؤمنين بأهمية الطريقة في علاج الكلابفوت. رسول لطريقة بونزيتي وبعمل على نشرها سواء في القاهرة أو في الأقاليم أو
The bracing phase helps to maintain and strengthen the clubfoot correction over a long period of time and is an essential part of the Ponseti method. After the final cast is removed, special shoes with an interconnecting bar are worn by the child to gently stretch the affected feet in an outward direction. For bilateral clubfoot, both feet are angled outward equally between 60 and 70 degrees of rotation. For unilateral clubfoot, the affected foot should be angled between 60 and 70 degrees of rotation, while the unaffected foot is angled between 30 and 40 degrees of rotation. During the first 3 months, the child wears the brace full-time for 23 hours a day. But after 3 months have passed, bracing progressively decreases, so that by the time your baby learns to walk, they will be wearing the brace only at bedtime and nap time. And while they're awake, they can walk in bare feet or wear regular shoes just like any other child. The bracing process will last up to 5 years. Parents must ensure their child wears the brace at bedtime and nap time every day in order to give them the best chance at successful clubfoot correction that will last a lifetime. However, clubfoot relapses may still occur, and they are especially frequent if bracing is decreased or stopped too early. Recorrecting the foot alignment will require more casting and more bracing. After the child is 5 years old and the problem still persists, a minor surgery called a tibialis anterior tendon transfer may be necessary to correct the clubfoot deformity.
I saw my job as a parent to educate myself with as much information as I possibly could. In clubfoot treatment, the correction part is so important. The casting part is really vital. But it's only, if done right, 6 to 8 weeks of a 4 to 5 year long journey. And the rest of that journey is really about the parents. It's about hands-on experience, putting the boots on, making sure that you're following the guidelines to give your child the absolute best possible chance to avoid a relapse.
La troisième chose, c'est qu'il faut prévenir les parents et vraiment les mettre dans le traitement pour qu'ils acceptent que leur enfant porte pendant plusieurs mois et plusieurs années cette fameuse attelle de dérotation, sous peine d'obtenir de nouveau des récidives qui sont plus difficiles à traiter.
Hi, I'm Dr. Evelyn Kwong, pediatric orthopedic surgeon at the Duchess of Kent Children's Hospital in Hong Kong. The Ponseti method of serial casting for the correction of club feet has really revolutionized the way we treat these patients. Hong Kong is a geographically small place, so our patients and families have not had much trouble coming back every week for the cast changes. And our parents are very grateful that their babies who are born with club feet achieve normal functioning feet after just a few plasters and a minor surgery. So the Ponseti method of serial casting for the treatment of club feet really is the standard of care now in Hong Kong.
由我陀 B 3到4個月嘅時候啦，有一次我哋去私家醫院做產檢嘅，咁超聲波查控到胎兒嘅腳掌方向有啲奇怪，咁就詳細幫我哋做咗個超聲波。咁當時我同爸爸聽到呢一個問題嘅時候啦，成個人都好驚慌啦，好緊張啦。然後不停咁問醫生啦，醫生就同我哋解釋呢一種病係可以醫好嘅，即係叫我哋唔使擔心。但係咧，我哋都係好驚，唔知以後小朋友可唔可以醫好啦。咁之後啦，醫生就寫咗一封骨科轉介信啦，到大口運根德幫助夫人兒童醫院。咁好幸運的，我哋就收到骨科兒童醫院俾咗個睇症期我哋嘅。即係邝醫生同我哋耐心解釋之下咧，我哋聽到邝醫生嘅解釋到放心咗好多嘅我哋。咁要我們的小朋友都正常成長、快樂長大。咁借此機會，我哋全家也萬分感謝骨科邝如玲醫生同成個護理團隊，令我小朋友完全康復。謝謝你們的細心治療及幫助，謝謝。
Hi, this is Sally and Lewis, and we live in Hong Kong. And our 5-year-old daughter Edie was born with bilateral clubfoot, which was treated with the Ponseti method, which is basically a combination of casting and braces.
Okay.
I was also born with bilateral clubfoot, and reflecting on my experience at first when we found out that Edie had clubfoot, I was a bit apprehensive and a bit nervous because I remember I was not treated with the Ponseti method, and I remember lots of operations. I remember bones being taken out, rods being fitted into my feet, and even to this day one of my feet is still got like a big staple holding two of the bones together. So I was a bit nervous that that was going to be the route of treatment for Edie. So then we were really happy and really relieved to learn about the Ponseti method, and that Edie wouldn't have to go through the same experience that I went through. And how do your feet feel now?
Oh, they feel good, and I got some special shoes. When my feet are fully better, then we can throw those in the bin, and I don't need them anymore.
And for any parents that have just found out that their baby is going to be born with clubfoot or has been born with clubfoot, our advice would be just take it one day at a time. Don't panic. As Lewis said, your kid will be fine. They're so much stronger than you think.
Lots of money. Are you going to sell those rocks?
I'm going to sell those rocks.
She's just started primary school. She's running around. She's able to partake in like PE and all the other normal activities at school. No one would ever be able to tell that there was anything wrong with her feet at the weekend. She loves going rock climbing, scrambling up waterfalls, running around at the beach, singing, dancing.
Your kid will surprise you and it'll be fine.
Even now, in my 30s, I'm still experiencing real stiffness in my feet, constant back pain and hip problems, which have all been a knock-on effect from the treatment that I received. But it seems like the future for Edie, her feet are already much more flexible than mine were at her age. And it seems like she'll have a much more kind of stress-free and easier journey into adulthood than I have. Thank you, Edie.
Bye-bye.
The parents with their children treated before will like to help the parents with the new babies, to help them to get the information, to get the appropriate doctor, to appropriate hospitals and clinics. It's very good for the distribution of the Ponseti method across my country.
In the 1990s, the Ponseti method was introduced in Japan. Now, almost all pediatric orthopedic surgeons adopt this method. Mothers are now more open to talking with others, but in the past, it was part of Japanese culture to conceal individual struggles.
People in Thailand have more awareness of clubfoot problems. The rate of surgical corrections or the patients who need to be surgically correct has dramatically dropped after I introduced the Ponseti technique to our programs. We haven't seen a neglected case like older kids or kids who has not been treated after 1 year, so for many years. I would say over 10 or 15 years.
Born in 1914 in Menorca, Spain, Ignacio Ponseti came to the University of Iowa to train in the world-renowned orthopedic clinic, led by Dr. Arthur Steinler.
During the 40s here, I was taught, and I was a fairly good surgeon, to operate on clubfoot in order to get the correction. However, I did look at the medical histories. They have been all right for a few years after the operation, but then towards 10, 15 years, they started to have pain, and by 20, 25 years, they had very severe pain, very severe osteoarthritis of all the joints of the foot, and there was no way that one could help them. And so I thought that surgery was really not the way to treat clubfoot.
Dr. Ponseti found that by using the natural joint motion of the feet, he could gradually move a deformed foot into proper alignment using only plaster casts, without any need for surgery. Then, utilizing special shoes with an interconnecting bar, the feet could be trained over time to maintain proper correction for the life of the patient.
I was sure then that was the way to treat clubfoot, but it was very difficult to convince the medical profession to do that.
Sort of late in 2007 we found out we were pregnant, and then in the early 2008 we went for our 20-week morphology scan, which picked up that there was an abnormality and that our little girl would have bilateral club feet when she was born. And I must admit, the shock of her seeing George's feet, I broke down and cried. I could not believe that they would be fixable. They were far worse than what I ever imagined. So she did the 6 casts, tenotomy, 3 weeks with these casts on, and then we went back for the final cast to be taken off and check her feet, and then progress into the Mitchell boots and bar. When the casts are on, you don't actually have a choice. They're on. But when the boots and bar are on, it's totally up to you to be compliant. It's totally up to you that when the baby's upset, or the baby's sick, or the little one at 2 or 3 doesn't want to wear them anymore, compliance will come down to you, and ultimately success will come down to what you're doing. Do your legs ever bother you now?
No.
No. Are you glad that you got Mum and Dad got your feet all done? And
Yes.
do you think you would have been able to do all the things that you can do now if your feet were still the way they were when you were born?
No bike riding, no swimming, no jumping,
So what sort of things do you do now?
racing, BMX, snowboarding and snow skiing.
My overall experience with the Ponseti method is, yep, time consuming, yep, it's years of work. However, absolutely do it again. If I had another baby today, I would not be at all concerned that my child had club feet.
One day, after he retired at age 70, because it was mandatory, he looked a little bit serious. And I asked him what was the matter, and he said, I think I am depressed. And I asked him why. And he said, because I have solved the problem of the clubfoot, and nobody is paying attention. And so I said to him, what you have to do is to write a book. So I learned how to use the computer. I was 70, I believe, at the time, or a little older, and decided to type what he would dictate to me.
Clubfoot has always been a strong interest of mine. The first 10 years of my practice, I was doing clubfoot surgery like I was trained to do, open surgery, posterior medial release, taking the foot apart and putting it back together again. And then in 1997, I had a chance meeting with Fred Dietz from the University of Iowa. Fred was one of Dr. Ponseti's colleagues. I said, Fred, is this stuff really true? Are you able to treat club feet without open surgery? And he said, absolutely, we never operate on the feet in Iowa. And he said, read Dr. Ponseti's book. He just published this book in 1996. So I bought the book, I read it 3 times, and then I started applying it to my practice. And after I've been doing it for a year, I was getting amazing results. All of a sudden, I went from operating on all my kids with club feet to operating on practically none.
That book is crystal clear. So much so that parents who have read it could follow it and understand.
Ella nació con la mala suerte de tener el pie equinovaro, más comúnmente llamado o conocido como pivot, y no estaba de acuerdo, no estaba feliz, no estaba tranquila con lo que tenía mi bebé. Gracias, junto con la Fundación Mexicana, me enviaron un listado con los médicos internacionales de todos los países que estaban certificados con el método Ponseti. Y en Bolivia había una sola doctora, que es la doctora Patricia Callisperis. Tu piecito precioso. Que te ayudaron, y das gracias a Dios, porque no sabías si lo iba a lograr, y no sabías, y todavía no sabes, no estás segura de cuánto tiempo, o si alguna vez va a retrasarse o va a volver el piecito. Es por eso que nosotros seguimos con el tratamiento. Según la doctora, son 5 años. Hija. Leila, sí. Con las férulas, de dormir, de usar las férulas durante 12 horas de sueño, justamente para que los ligamentos, los tendones, el huesito y todo lo demás se acomode como tiene que ser, y no haya una recidiva con el piecito.
In 1995, results of an important medical study were published, which followed clubfoot patients over the span of 30 years. It showed that the majority of clubfoot patients treated with the Ponseti method 3 decades earlier were still doing fine, while most of the surgically treated patients had long-term stiffness, pain, and recurrent deformity. Around that same time, several mothers whose children had been treated with the Ponseti method began using early internet forums to share their successes with new mothers who were seeking Clubfoot treatment advice. Positive word of mouth traveled quickly from mother to mother, and Dr. Ponseti, now in his 80s, was finally able to see his non-surgical Clubfoot treatment method spread throughout the United States and shortly thereafter throughout the world.
When we started training people in Africa, especially orthopedic technologists, we found that we absolutely had to have a technique that was non-operative. We didn't have operating rooms, we didn't have surgeons, and so we jumped on the Ponseti technique early and began to train non-doctors how to do it, found that it could be very successfully done, and we had large clinics. The clinic that we were dealing with there was seeing 40 babies every week.
Change the plaster weekly and your foot is corrected.
I was really devastated. I couldn't believe it was true. I don't even want to think about it, how I felt that time. When I came here, the doctor really comforted me. Right now I have hope really for my child. I do. He's roughly 5 days old. Yeah. Actually, my husband is so supportive. I have 3 children. I called them, I talked to them. But I told them there is hope. So they are positive about this. Advise a mother out there to really seek medical advice. Some people are not aware of that there is treatment. They don't know what takes place. So when they get such children, they know they connect it to curses, to other different things. However, it is not true.
Okay, I think we are done with the one leg. We are going to the other side. We shall do the same thing.
So right now he's full of sport. The bracing phase, we had some challenges, especially the first 3 months where you're supposed to put on throughout day and night. Right now we are still on the bracing phase, though it is only at night.
I'm Robert Simakula, the parent of El Shaddai. I want to first of all appreciate the doctors, especially Dr. Bilisa, for the work they are doing. We want also to encourage the mothers that they always remain hopeful, because with God everything is possible.
The treatment has been so good to the boy. The boy is walking, the boy can play, the boy can jump, the boy can do whatever he feels like. The treatment has really been good for us.
The neglected clubfoot used to be a problem in this country, but today in all the centers where we have Ponseti Clubfoot clinic, neglected clubfoot is now becoming a thing of the past. We had a national clinical guideline for clubfoot treatment, which has been adopted by the National Council on Health, and Nigeria happened to be the first country to adopt these guidelines. It's based on the recommendation of Professor Ignacio V. Ponseti. Basically, manipulation based on specific approach and doing tenotomy. 80% of them require tenotomy, and which is a clinic procedure. 2-3 minutes we are done, but the outcome is usually excellent when they follow appropriate bracing. So there's no fear, there's no panic. Ponseti Clubfoot is the answer, is the way to go.
se hacen manipulaciones y después empezamos ya. Definitivamente la técnica de Ponseti es 100%. Yo no he vuelto a realizar ninguna cirugía desde el 2010 para acá. Solo los he tratado con el método Ponseti.
¡Qué bien caminas!
Tenemos mejores beneficios para el paciente y a un bajo costo.
¿Cómo te lo pone mamá?
Solo le falta la llave.
¿Y la mamá? Sí. Porque la licenciada no. Gracias.
¿Listo, Sandino, el grabar?
Sí, un chelito de pancita.
Y me dijeron en San Miguel está una fundación, me dijo, de Jonispa. Y ahí me dijo los niños reciben tratamiento. Pues yo lo traje. Y gracias a Dios le doy porque el tratamiento a mi hijo le está bien perfecto. Los dos piecitos eran así, ambos los dos. Y pues para honra y gloria de Dios, el niño pues ya camina.
Eso para mí, bien dado. ¿Al doctor te leo?
Vamos a ver. Mira acá la cámara.
Mira la cámara.
Ese es.
En 2004, cuando yo era estudiante de segundo año de ortopedia, fui invitada a un congreso de ortopedia pediátrica y allí conocí el método Ponseti a través del Dr. Morcuende. En el Hospital Civil de Guadalajara, donde hice mi residencia y donde actualmente laboro como médico del staff en el servicio de ortopedia pediátrica, se realizaban entre 4 y 5 cirugías de liberación posteromedial a la semana como tratamiento de los pacientes que tenían pie equinovaro. Cuando me di cuenta que el método Ponseti era tan gentil y resolvía la deformidad que presentaban tantos niños sin tratamientos cruentos, empezamos a aplicar los principios aprendidos y observamos cómo disminuyeron drásticamente la cantidad de pacientes que requerían cirugías. Nosotros quienes hacemos método Ponseti somos parte de una filosofía de hacer las cosas con amor, pero sobre todo de cambiar las vidas de los niños que tratamos.
Hello, my baby was born with bilateral talipes and we found out at her 20-week scan. It was really hard when we found out. I didn't know what it was or what to think. So at 10 days old, Thea got her first cast put on. That wasn't nice. However, we had no option. Thea wouldn't have been able to walk if we didn't have the cast put on. But then the nurse and the physio was so lovely, so supportive. So the cast get changed every week from there until 6 weeks. At 6 weeks, Thea had to have her Achilles cut on both ankles and reset into casts. Then after the 2 weeks, she goes into boots and bars. Boots and bars have been the hardest bit of the journey for us so far. And she'll have to wear them until she's 5, and she's 15 months at the moment. Thea started walking at 12 months, and yeah, it hasn't stopped her development one bit. Thea is now 4.5 years old, and she's doing really well in her talipes journey. She wears her boots and bars all night and for 12 hours a night, and we still see the consultants at the hospital every 3 to 6 months at the moment, depending on her development at the time. She's really active, she loves gymnastics, running, climbing, everything. So I would say to anyone that's expecting a baby with talipes, please try not to worry about their physical development. It hasn't held her back at all.
Para o ortopedista, ela representa um resgate da relação médico-paciente e é muito gratificante porque você consegue, com a sua mão, sem nenhum outro meio, mudar realmente o status daquele membro para a vida toda. Então, tanto a parte inicial, que você mesmo tem que fazer a escultura do gesso, né, moldar o gesso, quanto a segunda parte, que você é praticamente um conselheiro da família, resolvedor de problemas, seguidor daquele desenvolvimento. Isso é muito, muito bom. E é muito importante que as pessoas façam realmente o método como ele é, e não adaptações estranhas que levam a resultados também estranhos.
I'm Dr. Safdar Ali Sheikh and I'm from Pakistan. My son was born in 2014. He had bilateral severe condition to which you call a clubfoot. So initially I was very much worried. My wife, myself and my parents were worried, but we heard that it does not require any major surgical intervention. At the age of first week his treatment started. They had to apply complete plaster from feet till hips, and it started from first week, and every week we had to change that plaster. He did tenotomy of the tendo-Achilles from the both sides, bilateral sides, in local anesthesia, and after that he applied a plaster that lasted for around 3 weeks, I think. These specialized shoes ended at the age of almost 4 years, and then he started going to school. This is my son. What is your name?
Ayan Ali.
Very good. How old are you?
6.
6 years. So now you can see his feet. See from the side, from the lateral angles, and I am showing you the site of the tenotomy also. See if you can appreciate. This is a small scar. He loves to play football, he loves to run, and loves to do all the activities that a normal boy does.
The objective of Pakistan Clubfoot Disability Prevention Program, which we set in 2012, was to prevent the disability from the deformity of clubfoot by providing early treatment, early referrals, capacity building, and propagating the message among the masses. In 2012 and 2013, we had only 4 clubfoot clinics in Pakistan. Today, we have 110 clubfoot clinics in Pakistan at each district level, in each medical university and the armed forces. There is significant advantage of clubfoot clinic when a patient comes to you and all the patient for the management of clubfoot are sitting together discussing each parent are discussing with the other parent, and also looking on the patient which are getting the management with percutaneous tenotomy, casting and the application of braces. This increased significantly the propagation of message of best treatment of Ponseti methodology in clubfoot management.
The doctor's office called us. The nurse said that the ultrasound tech thought she had seen clubfoot or something with the feet, so they wanted us to go to a fetal specialist. So at the time we lived in Casper, Wyoming, so we had to drive 4 hours to Denver to see a specialist. And he was born, and that was I remember that was the first thing I wanted to see was, so what do his feet look like, I'd never seen a clubfoot baby. That was the first thing we did. We looked at his feet, and they were super cute. Yeah, they were cute, but they were definitely all turned in. And we started his casting in December, and there were some major snowstorms and sub-zero temperatures, and we lived out in the middle of nowhere, so we had to go over frosted tundra to get there, and it was every week.
They check the feet to see how flexible they are and what adjustments might need to be made, and then they casted him, and he stayed in the cast for a week. We'd come back down, so they'd cut off the cast, and then they would pull it into a new position, wrap it in that position, and then we'd come back week after week. I think we had to redo one cast. After 4 weeks, we did the tenotomy, and he was in that cast for 3 weeks, and then they came off.
The one that was really hard for me was when he did the tenotomy. So it was they just did a local anesthetic on him for us, so they had us put a numbing cream on his heels, and then they had us wait for a little bit. I don't remember if it was a full hour or half an hour. And then once that was numbed, they took him back, and they did just super quick. I mean, they took him back, and within 5 minutes, it felt like she had come back out to get me. After that, when I went in and she handed me my son, and he was fine. He was asleep, I think. I mean, he must have been lulled to sleep. The next day, he was just back to his happy self.
Tu veux ça?
We're so grateful and so blessed to have the Ponseti method that is effective, it's relatively quick, it's minimally invasive. I'm so glad for that. I'm so glad he didn't have major surgeries, that he didn't have to go under anesthesia. Now we're bracing, and it's just part of his life. Like, so he sleeps at night with his boots and bar, and it's just what we do. It's just the bedtime routine. You know, you put on his pajamas, change his diaper, sing a song, put on the boots. That's just his life. So.
After the treatment, you need to have comfortable shoes for the babies, to have to sleep at night on them, and to have them used in the middle of the day, so their napping hours. And I was really very desperate trying to find a shoe that will fit the babies with comfort. And here I talked to John Mitchell, and because he was acquainted with plastics and modern technologies that I had no idea of.
I was in the clinic with him, and in the little room, and there was a mom there with a baby. And I remember meeting that mom a few months ago when I was there, meeting another doctor. And I was like, and the baby was probably 6 or 8 months old. And I go, hey, I remember meeting you a couple of months ago. I go, how come you're back? And she said, oh, we had a relapse. And I said, what was the matter? And she said, well, the brace didn't fit right.
Our daughter Madeline was born with a severe unilateral clubfoot, and we were referred to the University of Iowa hospitals, where she eventually was treated by Dr. Ponseti.
Some of the things we're noticing with the original brace is the foot would slip around a little bit and not hold it near as tight, and there'd be some little blisters that would develop on the sides and just in the back, you know, and she was just more agitated.
And I looked, and there was blisters and sores on the feet, and I just thought, oh, it's terrible. I told Ponseti, I go, Ponseti, why don't you get a hold of that company and have them fix these braces so they don't hurt the babies? And he looks at me and he goes, why don't you do something about it?
And he, on his own, developed this excellent shoe that I needed, particularly for difficult feet that we call complex feet.
We were the number 1 or number 2 patient to experiment with this brace.
It fit to her foot, but yet it just appeared to be more comfortable. And as a parent, that was important.
It has been a godsend, really, because it has solved the problem of the after treatment of the deformity.
I'm glad that I've been able to help him get his dream of getting it spread around the world.
He was such a gentle man with our daughter. Like, he was so gentle. Madeline, he called her Madeline. And he remembered us every time we walked in. You know, he knew our case, and just very, very gentle. That's the word that comes to mind. Not only in the treatment of the foot, but just his personality.
I'm very grateful that I was still able to be a part of my volleyball team and be dancing at my dance studio, just because as a young girl I never knew, like, it could get worse, it could be better, like, we never knew what would happen. So I'm grateful that I became stronger and was still able to do those activities that I enjoyed.
We would like to thank Dr. Ponseti, Dr. Morkwende, Dr. Dietz, all of the doctors that had anything to do with Maddie or with us while we were out there. Maria was amazing. The work that they did there, not just for her foot, but to comfort us and to reassure us, and just to guide us in this decision-making process. It was a long, long road for us. Madeline has become a pretty strong kid through all of this. Not just physically tough, but I think it helped develop her character too, and who she is today. Like, you know, she's been through a lot, but she didn't let it stop her, and we're just grateful.
The environment what you have to do this, it has to be very calm for the baby and the family. You are doing a stretching in the muscles, so the kid has to be relaxed. If the kids start crying and the muscles tied up, it's very difficult, and then it creates pain because you try to stretch something that is tight. And if the baby is relaxed, it doesn't cry, then the family feels more comfortable. A good Ponseti cast is the one that has a triangular shape and has built a little bit of an arch for our support. It is very well molded around the ankle, so it holds the foot down and also allows the calcaneus to drop down. There's no point of pressure, especially on the lateral side, because that will create a dip into the skin and the bone, and that can be a cause of sores. The tibia is straight and the leg is bent to 90 degrees with good molding behind. This is a full leg cast and goes from the tip to the toes all the way to the groin area, and there is this protection that helps to avoid the problems with the skin when the kid moves. The foot abduction brace is a bar or some sort of bar that can be plastic, can be wood, can be metal, can be anything. It's just a bar, and then two shoes. So the critical component of a brace is that the shoes have to be comfortable. They have to be soft. They have to conform the shape of the foot of the baby, and then the toddler, and then the older kid. If it hurts at night and creates sores in the kid's feet, then there's no way that family can, continue for 5 years. I was really lucky and honored to work with Dr. Ponseti from 1991 to 2009 when he passed away. He was very compassionate and dedicated to his profession, and especially to the children that he was taking care of through his life. And that is, I think, how most people remember him, as a wonderful human being.
In Africa, the child will have been born with club feet, and the mother may not be initially aware of it. They may feel this is witchcraft, they may feel this cannot be treated. We've raised awareness now so that there's a network of people who can tell the mother that no, this is clubfoot, they can be treated by the Ponseti method, and where she might go, where the nearest clubfoot clinic is, where it can be treated.
So, yeah. After she delivered him and the sister was washing him, then the sister noticed that he had clubfoot.
Was it unilateral, bilateral?
Maybe also on one.
No, one. Ah, the right foot.
And what did you know about clubfoot at the time?
What you been know about that kind secret? Been get any knowledge about her? No. He didn't know anything about it.
No.
So are they talking now? But after the second or the third cast, you can see relief on her. Even the husband was like, "Oh, I'm sure things will work out," because we told them it's not the fault of the woman.
Yeah,
it's something genetic.
What advice do you give to those mothers that are nervous and come in with their kids and don't really know what they have ahead of them?
The worthy them people are in it, Mrs. No future from the beginning.
Be patient, because here in Africa, our children are our future.
He just wasn't totally untreated. Yeah. See where he walks with the sweat. It's a good foot, yeah? Better.
If a child has their clubfoot corrected, then it's a normal plantar-grade foot. They will be able to wear normal shoes. They will be able to walk to school. They will be able to take part in sport and play normally. And ultimately, as adults, they will be able to undertake manual occupation. So the legacy of correction is very profound.
We estimate that 1 in 800 babies worldwide are born with clubfoot each year. That's around 175,000 babies. Back in 2007, we began to see the success of Ponseti treatment replicated in lower and middle income countries and provided on a country-level scale through national programs. Our data shows that the number of countries where Ponseti treatment is offered has increased to more than 60 countries, with well over 30,000 children starting treatment every year. However, there is still much work to be done. These 30,000 are only 1 in 5 of the children that we would expect to be born with clubfoot.
Hello, my name is Igor.
And my name is Kate, and we live in St. Petersburg, Russia.
And we would like to tell you about our experience in Clubfoot treatment using the Ponseti method.
I have a daughter, her name is Maya, and she was born with a Clubfoot deformity on her right leg.
Unfortunately, our first doctor doesn't follow the Ponseti method.
But we didn't know it.
Yes, and during this treatment we made, I suppose, 5 casts. We thought that we are doing everything right, but when the doctor said that we have to be ready for surgery, we understood that something was wrong.
We weren't ready, it scared us.
So we started to search another doctor who could help. Lucky that soon we made a great team of the doctors who were practicing the Ponseti method. It was decided that Maya's leg need to have some rest, since it doesn't turn to the needed position.
Now we don't remember the total number of casts, but when they were finished, we started to wear braces. The beginning of this new period also was a little difficult, but shortly it came to the normal, common way. Moreover, as casts helped Maya to turn from her back to her stomach using its additional weight.
Last 6 months of wearing braces was pretty hard, since Maya felt herself uncomfortable when the whole day she was free but had to wear braces while sleeping. She cried and asked to let her to remove them.
It was difficult for me to stay on wearing braces and to be strong, but it was it. During the summer she worked out her leg very well. She swam, ran, rode bicycle and did all activities that children usually do. She's fine. Now she's 7. She's doing karate again and a month ago took a 2nd place on the competitions.
We want to thank so much our doctors Vladimir Kenis and Julia Stepanova for our healthy daughter, and Dr. Ponseti for his method. Thank you very, very much.
Not so many methods in pediatric orthopedic practice give us so positive emotions like Ponseti method. And when we first see the baby with congenital clubfoot, when we see the parents in stress with so simple and so effective manipulations, we can give to the kid and to the family the perspective of being healthy and being active and being involved in the social activities. And we are proud because of our patients, because of our children, because of their families. And we do small but very important part of the global work for the Russian children.
Clubfoot, as well as other pediatric orthopedic problems, are not so well known in Belarusian society as cancer, diabetes, or cardiovascular diseases. Quite often parents are ashamed to show up with their child publicly before they finish treatment. Some neighbors may see Clubfoot as a curse or even something contagious, but usually all that can be overcome through simple explanation, friendly talk. There will be hills and valleys during bracing period, but what you need to remember is that it is all part of the treatment protocol that is highly effective but takes time.
Oğluma 11 yıl önce pesekino ağrısı teşhisi konuldu. İlk olarak biz ultrasonda öğrendik bunu, 20 haftalık ultrasonda. Tabii ki büyük bir şok oldu bizim için. Çünkü hiç duymadığımız bir şeydi. Etrafımızda görmediğimiz bir durumdu. Şanslıydık ki Türkiye'de de bu Doktor Ponseti'nin yöntemini uygulayan iyi doktorlar vardı. Yaşadığımız şehirde de vardı. En zoru ortezlemeye alışma süreciydi. Onur çok hareketli, kısıtlamaya gelmeyen bir çocuk olduğu için ortezin getirdiği o kısıtlama ilk zamanlar onu çok zorladı. 3-4 sene jimnastik yaptı, yelken yaptı bir dönem. Biniciliğe merak saldı, at bindi.
Bu kesin sporcu olacak ama sen söyle.
Ama en sonunda yapmak istediğinin koşmak olduğuna karar verdi ve 8 yaşında koşmaya başladı. Hatta en son Türkiye'nin en hızlısı yarışmasında Türkiye'nin farklı şehirlerinden birçok yaşıtıyla birlikte final koştu. Çocuklarınızın hayatına bir engel getirmediğini, tedaviyi doğru uyguladığınız ve çocuklarının normal gelişimine izin verdiğiniz, bunu desteklediğiniz sürece sizlerin de Onur gibi mutlu ve başarılı çocuklarınızın olacağına ben inanıyorum.
Hastanın bu kadar başarılı ayaklarının olmasındaki en önemli etken ailesinin bilinçli olması ve söylenenleri çok düzgün yapmaları. Ama Türk toplumunda maalesef aileye karışan çok fazla insan olur. Aile büyükleri, bütün komşular, çevre karışır. Çocuğun ayakları düzeldi, artık bu ayakkabıları çıkar. Çok ağlıyor, ben dayanamıyorum gibi söylemlerle ayakkabıların erken çıkarılmasına veya düzgün uygulanmamasına sebep olurlar. Böyle olunca da maalesef ayakkabı itirazı ülkemizde daha çok görülüyor.
Merhaba, ismim Ahenk Özüm. İstanbul, Türkiye'de yaşıyorum. 2,5 yaşında çift taraflı pes ekinovirüs teşhisi koyulmuş bir oğlum var. İsmi Deniz. İnternetteki araştırmalarımız sonucunda Ülke Hanım'ın oluşturmuş olduğu pesekinovirus.org sitesinden onların hikayelerini okuduk. Ve çok şükür ki bunun bir sakatlık olmadığı, doğru tedavi ve doğru doktorla geçici bir şey olduğunu öğrendik. Pesekinovirus anne içinde, bebek içinde zorlu ve uzun süren bir rahatsızlık. Süreci uzun ama çaresiz değil, çözümsüz değil. Benim için zor oldu. Yeni doğum yapmış bir anne olarak alçılar içinde bebeğimi görmek benim için çok zor oldu. O sürece çok zor alıştım duygusal olarak açıkçası. Ama çok da kafanıza takmayın çünkü iyi olacak. Eğer doğru doktor, Ponseti yöntemi, ortez kullanımıyla her şey yoluna girecek ve çocuğunuz diğer çocuklardan farksız olacak.
Merhaba çocuklar. Benim ismim Deniz. Benim ayağım da sizin gibiydi ama artık iyi geçti. Ben 5,5 yaşındayım ve kesik.
My name is Dawn. This is Magnus. We're from Yukon, Canada. When he was born, the surgeon came to see us on the maternity ward and did an assessment and diagnosed him with bilateral club feet. And we started casting the very next day. It was around the 4th cast that we noticed that the bottom of his foot was starting to get a little bit of a rounded shape. And I brought it up to the doctor a couple of times and was told that it was fine and that it would go away after having the tenotomy, or he may need a surgery to pull his heel down. And hearing that, I guess, after being a part of some parent support groups on Facebook, it was a big red flag to hear that he might need surgery. His foot was obviously a rocker bottom. There was no mistaking it. I decided to email Dr. Pirani with pictures of his foot and ask if there was something wrong with it. And I got a reply that yes, it was concerning. I can't tell you what a relief it was to find Dr. Pirani and to have him treat Magnus. It was like a night and day experience, how gentle he was in manipulating his foot, and Magnus didn't cry once having casts put on. The rocker bottom had completely gone away. I don't think that I will ever be able to thank Dr. Pirani enough for fixing Magnus's foot. The fact that Dr. Pirani was able to fix it in 3 casts with his calm and really experienced manner in treating club feet with the Ponseti method, it just shows how well it works.
Surgery has been an option for many years, and in fact many textbooks, probably still to this day, will list surgery as almost always necessary for clubfoot. I believe this is wrong. We now have evidence that the outcomes of treatment after surgery, though seemingly very good initially, after a decade or 2, they leave the foot very stiff and very painful.
We went through a phase not that long ago in modern time, this is in the 60s and 70s and 80s, where surgery was the most popular treatment for clubfoot. And it was an unfortunate time era.
In the surgical era, the feet were so stiff that we started to see significant pain and functional impairments in the teenage years. Ponseti has shown with 30 to 40-year follow-up that the individuals treated by his method don't have pain. They can remain functional at a recreational activity level. They can be fully employed. They can be complete members of society despite the fact that they were born with a clubfoot.
Any surgery leads to scar. Any scar leads to stiff fibrotic tissue, and any fibrotic tissue shrinks with time. It's inelastic. It causes stiffness and long-term deformity.
I discovered the clubfoot of my son when I was pregnant, 6 months pregnant. I was shocked, really, and stressed. I looked on the internet and I found some information about Ponseti method, and I found a group on Facebook who was very helpful. Oui. You can cry if a baby is here. When he's here, it's hard. But try to be positive. For me, it's important. I also use cover bar like that, and it helps me to accept the breathing too. I also put, when he was little, some toys on it. Like this, he can play with his legs. Yeah.
Arrête, je m'occupe de ton frère 5 minutes, vas-y.
Bonjour, je m'appelle Katia.
Et moi Guillaume.
Et nous sommes les parents de la petite Rosalie qui a aujourd'hui 10 ans. Lors d'une échographie en anténatale, on nous a appris que Rosalie naîtrait avec les pieds varus équins bilatéraux ou plus communément les pieds bleus. Et puis on est rentré chez nous et là on a donc décidé de faire des recherches un peu par internet et on s'est rendu compte donc qu'il y avait en fait une autre méthode qui existait, la méthode dite orthopédique.
Celle du docteur Ponseti.
Voilà. Donc le challenge, ça a été de trouver donc en France l'hôpital et le médecin qui allait pratiquer cette méthode dans son entièreté. Parce que du coup, donc, on a passé 6 mois en fait pour arriver à trouver Anna Precedo, qui est notre médecin adoré, voilà. Et donc dès le 3e jour de vie, Anna s'est occupée donc de Rosalie avec la pratique donc des plâtres, puisqu'il y a donc toutes les semaines un changement de plâtre. Donc dès le 3e jour de plâtre, elle a posé le premier plâtre, et puis une semaine après le 2e, etc. Voilà. Et puis après donc la pose de la telle, 23 heures par jour, puis seulement après pendant la sieste, voilà. Et puis jusqu'à arriver aujourd'hui avec une petite Rosalie qui est tout à fait normale.
Maman, au revoir, maman, papa.
Qui vit très très bien, qui marche très très bien, qui fait du sport, de la capoeira, de la danse, du vélo comme vous avez vu, du roller.
C'est juste l'attention particulière sur des chaussures avec un bon maintien.
Voilà,
mais
c'est
sinon c'est Rosalie grande et libre, épanouie. Merci
voilà.
Ponseti.
Merci. Merci Anna et le docteur Ponseti, oui, tout à fait.
I learned the method with Dr. Ponseti himself when I was a young doctor working in Barcelona. I think that the main advantage of this technique is that you can correct the foot very fast and then maintain the correction with the braces. It's very important to spread knowledge about the casting technique in order all teams or practitioners involved in Clubfoot treatment be able to use this method all over the world.
I started STEPS because my son was born with Clubfoot, and I found an innovative method that wasn't actually available yet in South Africa, even though it had been done for over 50 years. And I took him to America, had successful treatment, and came back, brought the method to South Africa, and trained initially 60 doctors. Now 600 medical professionals have been trained, and over 10,000 children have had access to this method. We are committed to having every child born with Clubfoot in South Africa able to lead a completely functional and normal life, to go to school, to play with their friends, to live without shame or pain when there is actually a treatable solution to this problem.
It is quite standardized, so it's easy to train, it's easy to teach, and then more people are able to execute this procedure in the standardized manner. The availability of social media, that plays an important role, at least in my country, because the families, they start to share messages and they can take photographs, show photographs from their kids compared to each other, and that reinforce the need of good compliance. And this actually has changed a lot, and that contributes towards the better outcome overall with the total method of Ponseti treatment.
The champions really have been the parents, the moms who have gone through this, who've said, this works, and they're telling other people. It's the word of mouth. At the end of the day, the answer is it can be treated. And before your child takes their first steps, they can be walking on straight feet, and they can grow up never knowing disability, and they can have every opportunity that any other child had.
Give us a little bit of overview of Clubfoot specifically for India.
In India, every year 30,000-40,000 children are born with the Clubfoot. So last year we enrolled 10,500 children, but long way to go. Many children are still left without treatment. What has made the Clubfoot program in India is the Ponseti method. With no surgery, with just 4 to 5 or 6 weeks, the foot can be corrected, and that gives extraordinary relief to the family also.
We are just trying to identify the children at an early stage, and we are bringing them to the hospital, and we are starting them treatment. So after a series of castings, then we are providing free of cost the braces. So once the child is enrolled with us, so we will be completely taking care of them up to 4 to 5 years until the child gets completely recovered. So we are completely responsible, sir.
He was diagnosed with a Clubfoot when he was in the womb, when he was 5 months in the womb. And till from that time I was very worried about his condition. In private hospitals, yes, doctor recommended us surgeries. Then I came back, I searched on internet, it was not actually the case. With the Ponseti treatment, the surgery was not at all required. Only the tendon needs to be cut. It is a minor surgery. With that it will be okay. That's what I heard. and that is what he has been through, and now the foot is completely corrected, the right foot.
So nowadays, when we have for example, national conference, there's a Clubfoot session. If somebody, some of the speakers will talk about they use extensive surgery for the treatment of Clubfoot. The other colleagues will say, this is why you don't use the Ponseti method, so on and so forth.
If you follow the protocols as Dr. Ponseti described 70 years ago, now the results are excellent. But the key is you need to find a doctor that applies the method properly.
This is a gentler method and it works better for the child and it is better for the long term.
I learned Brooklyn had Clubfoot during a 20-week ultrasound. We found out she had right unilateral clubfoot. I think having a good understanding of the treatment process definitely made the journey easier. Going through the casting, that was a milestone and something to celebrate and accomplish. Having a tenotomy was something to celebrate and accomplish, going through that. And then starting bracing, there's two aspects. There's finding a great medical team who's going to do the Ponseti method appropriately. And the other part is finding a support system, a family and friends and other Clubfoot families.
Good job. Can you hippity hop? She can do it. She can. I saw her. I did it this morning. Good job.
The feeling of not having control is something that's very difficult for any parent in any circumstance. And the nice thing about Clubfoot is I can say with certainty that I know the children will do well. When parents really feel the best is when the child starts to walk. Those first steps, really help parents understand, okay, they walked, they're going to be okay.
We found out about the Ponseti method, and then we started talking to doctors and our pediatricians.
And I feel like doing the research and corresponding with Iowa really helped strengthen me and strengthen us, because once he was born and we saw the Clubfoot, we were like, okay, we know what to do, we know where to go, and we know how to get started.
The anxiety is now more, okay, what's the next step? What do we have to be ready for next? How do we adapt next to what his needs are going to be?
Hi everybody, we're now 2 years later. Niam is 2 years old. We just celebrated his birthday a couple weeks ago, and he is doing great. We're in 12-hour wear at nighttime in the Ponseti brace, and it's just a part of our normal routine now. The bar and the boots come out at bedtime, and he thankfully is accepting and wears the set like a champ. We take it off in the morning once he wakes up, and we go about our day. It's like a normal toddler, runs around, goes up the jungle gym, down the jungle gym, down the slide, runs around the neighborhood, starting to learn how to ride a tricycle. So we're having a great time, and very, very thankful for Dr. Rodriguez's guidance and the Ponseti method.
Okay, go Niam, go, go, go, yay!
So fast.
Awesome!
The key for us was being consistent right off the bat early on with the treatment plan, that it's become part of our routine, and it's also alleviated a lot of our fears that we had early on about his mobility, ability to play on the playground, do normal toddler things. He's doing it full bore.
I'm so lucky to have two of Dr. Ponseti's patients. This is incredible in our clinic. What does it feel like to have, grown up with Clubfoot?
Well, I guess starting out, it was, I never really noticed it at all until I was older and could comprehend it, but it wasn't really something that affected me that much. There was a few times where I would notice if I run too much, sometimes it gets a little bit painful every now and then, but generally I can do everything I would normally be able to do. So.
Yeah, I didn't really notice any pain growing up. It was completely normal for me.
I am in the top high school marching band in the nation currently, and I'm the lead bass trombone player. and so I basically just walk in a straight line really well and
playing music.
Yeah.
How about you?
I'm a competitive snowboarder. I got first overall in my age group for the nation.
Woohoo! You guys are stellar. I can cry right now. I'm so excited.
In 2009, Dr. Ignacio Ponseti passed away peacefully at the age of 95. But the impact of his revolutionary clubfoot treatment method continues to grow, changing people's lives all over the world every day. In many countries, the Ponseti method is now considered the gold standard for clubfoot treatment. And if followed closely, the Ponseti method can give your child the best chance at a lifetime free from the disability associated with clubfoot.
Don't be scared. Don't be afraid. Just find a doctor who's practicing the Ponseti method.
We did it, and now we have our family trophy.
A special one. Show it, please.
This is it. This is the last cast which Maya worn after the healotomy, and this is the most important trophy
of our family.
Take a deep breath. It's all gonna be okay. And find the best Ponseti trained doctor that you can, and build a really good relationship with them.
Such things can be corrected. All they have to do is to contact health workers. I think they can help really.
It's not as bad as you think. There's treatment that's relatively painless for them, and it'll be harder on you than it is your little one, and it'll be over before you know it.
Hang in there. It's going to be a little bit hard at first, for sure. I'm not saying it's not hard, but once you get through that, then it feels like smooth sailing. I mean, it's just normal life now.
Definitely not easy in the beginning, but as you go through the motions and the treatment, you learn a lot, and there's a lot of support in the clubfoot community.
As long as we just stick to the regimen that we do, that's been advised by the doctor, and so far so good.
Find support and ask for help. As and when you need it, ask for help. And it's a really simple process, and the chances are that your child will be absolutely fine at the end of it.
Look at it as that this child is special, and that you are special, and that this has been given to you for a reason. Please persevere, please persist, because their success, which is for the rest of your child's life, does hinge with you doing the right thing.
That's it really. I would say that the journey is quite a long one, and the beginning is very busy. However, if you're in good hands, it's all worth it. It's all worth it.